If you're over 65 and you've been told that walking is the best exercise you can do, this might surprise you. What if I told you there is one simple exercise, safer on the joints, easier on the heart, and actually more effective than walking for strength, balance, and longevity? An exercise many surgeons quietly recommend to their older patients because it protects the knees, strengthens the legs, and reduces fall risk. Stay with me, because this could completely change how you think about staying active after 60. As we age, walking has always been treated like the gold standard. Doctors recommend it. Friends swear by it. And for years, it really has helped millions of people stay mobile. But here's the truth, most people aren't told. Walking alone, especially after 65, has limits. It doesn't fully activate the muscles that protect your joints. It doesn't significantly improve balance. And for many seniors, it can actually increase knee, hip, or lower back pain over time. Surgeons see this every day. Patients who walk faithfully for years still come in with weak thigh muscles, unstable hips, and poor balance. Not because walking is bad, but because the body changes after 65. Muscle mass naturally declines. Reaction time slows. The small stabilizing muscles that keep you upright stop firing as efficiently. And once those muscles weaken, the risk of falls goes up dramatically. That's why many orthopedic and vascular surgeons now recommend an exercise that looks almost too simple to matter. It doesn't require a gym. You don't need special shoes. You can do it at home, holding onto a chair or countertop. And research shows it activates more muscle groups than walking, especially the ones most responsible for preventing falls. The exercise is controlled sit-to-stand movement, also known as the chair squat. Before you dismiss that as too easy, let me explain why this movement is so powerful. Every time you stand up from a chair, your body uses the quadriceps, glutes, hamstrings, core, and even your lower leg muscles all at once. These are the exact muscles that help you climb stairs, get out of bed, and catch yourself if you trip. Walking, by comparison, uses momentum. Once you're moving, your legs swing forward with less muscle engagement than you might think. In older adults, walking often becomes more of a shuffle, with shorter steps and less push-off from the back leg. That means fewer muscle fibers are activated, especially in the glutes and thighs. Surgeons focus on function. They don't just ask, can you exercise? They ask, can you live independently? Standing up from a chair is one of the strongest predictors of independence after 60. Studies have shown that seniors who struggle with repeated sit-to-stand movements are far more likely to experience falls, hospitalizations, and loss of mobility. This is why chair-based strength movements are now used in hospitals, physical therapy clinics, and post-surgery rehab programs. After knee replacement surgery, for example, patients are often encouraged to practice sit-to-stand long before they are allowed to walk long distances. The goal is to rebuild muscle strength and joint stability safely, without excessive impact. Another reason this exercise outperforms walking is joint protection. Walking, especially on hard surfaces, sends repetitive impact through the knees, hips, and spine. For seniors with arthritis or cartilage wear, this can cause inflammation and pain that discourages consistency. Chair squats, when done slowly and correctly, keep the feet grounded and allow the joints to move through a controlled range of motion. This builds strength while reducing strain. Balance is another critical factor. Falls are the leading cause of injury-related death in adults over 65 in the United States. Walking improves cardiovascular health, but it doesn't challenge balance in a meaningful way. Sit-to-stand movements force your body to stabilize itself as your center of gravity changes. This trains the nervous system to react faster and coordinate muscles more efficiently. There's also a circulation benefit many people don't realize. When you stand up and sit down repeatedly, the muscles act like pumps, pushing blood back toward the heart. This improves lower body circulation, helps reduce leg swelling, and supports vascular health. Surgeons often recommend this movement to patients who are at risk for poor circulation or prolonged sitting. Perhaps most importantly, this exercise is scalable. If you're just starting, you can use your hands for support. As you get stronger, you can cross your arms or slow the movement down to increase muscle activation. Even doing a few repetitions several times a day can make a noticeable difference in strength and confidence within weeks. To get the real benefits from this exercise, how you do it matters just as much as doing it at all. Surgeons and physical therapists emphasize slow, controlled movement because speed hides weakness and increases strain. The goal is not to rush, but to teach your muscles and nervous system to work together again. Start with a sturdy chair that doesn't roll or slide. Place it on a flat surface. Stand in front of it with your feet about shoulder width apart, toes pointing slightly outward. This foot position helps protect the knees and allows the hips to do more of the work. If balance is a concern, position the chair near a wall, countertop, or heavy table you can lightly touch for support. Lower yourself down slowly, as if you're sitting back into the chair, not straight down. Think about pushing your hips backward rather than bending forward at the waist. This small shift takes pressure off the knees and engages the larger, stronger muscles of the hips and thighs. Gently touch the chair with your hips or sit briefly if needed, then press through your heels and stand back up. Surgeons often say the most important part of the movement is the standing phase. That's where muscle activation peaks. Focus on pushing the floor away with your feet. Squeeze your thigh and hip muscles as you rise. Try not to rely heavily on your arms unless you truly need them. Using the legs as much as possible is what rebuilds strength. Breathing also plays a role. Exhale as you stand up. This helps engage your core and reduces unnecessary strain. Inhale as you lower yourself back down. Simple breathing patterns like this improve stability and make the movement feel smoother and safer. One of the most common mistakes seniors make is dropping too quickly into the chair. This removes tension from the muscles and puts stress on the joints. Another mistake is letting the knees collapse inward. If you notice that happening, imagine gently pushing your knees outward as you stand. This activates stabilizing muscles around the hips and knees that protect against injury. Now let's talk about how many repetitions are appropriate. Most surgeons recommend starting with just 5 to 8 repetitions at a time. That might not sound like much, but quality matters more than quantity. Perform them slowly, resting briefly if needed. Over time, work your way up to 10 or even 15 repetitions per session. Frequency is where this exercise really shines. Unlike long walks that require scheduling, good weather, and energy, sit-to-stand movements can be done multiple times a day. Surgeons often suggest doing a small set in the morning, another in the afternoon, and one in the evening. This spreads the workload and keeps the muscles activated throughout the day. What makes this approach especially effective is something called functional strength. This isn't gym strength. It's the ability to move your own body through space safely. Every time you stand up from a chair, you're practicing a movement you rely on dozens of times a day. The brain learns this pattern quickly, and improvements often show up faster than with traditional exercise. Many older adults report noticeable changes within 2 to 3 weeks. Standing up feels easier, stairs feel less intimidating, balance improves subtly but consistently, confidence increases, which is an often overlooked benefit. Fear of falling causes many seniors to move less, which leads to more weakness. This exercise breaks that cycle. Surgeons also appreciate how adaptable it is for different health conditions. If you have knee arthritis, limiting the depth of the squat can reduce discomfort. If you have hip stiffness, focusing on slower movement helps lubricate the joint. For those with heart concerns, the exercise can be paused easily. Unlike walking, where stopping abruptly can feel uncomfortable, there's also strong research backing this movement. Studies comparing walking-only programs to programs that include sit-to-stand exercises consistently show greater improvements in leg strength, balance scores, and daily function in the sit-to-stand groups. In some cases, participants improved walking speed more from chair exercises than from walking itself. Another overlooked benefit is posture. Standing up correctly requires alignment of the head, shoulders, hips, and feet. Over time, this reinforces better posture during daily activities. Better posture reduces back pain, improves breathing efficiency, and even enhances circulation. At first glance, it may seem hard to believe that an exercise done next to a chair could support heart health better than walking, but surgeons and cardiovascular specialists understand something important about aging physiology. After 65, the heart doesn't just need steady movement, it needs muscle support to reduce strain and improve efficiency. When large muscles in the legs are weak, the heart has to work harder to pump blood against gravity, especially from the lower body. Strong leg muscles act like assistants, helping push blood back toward the heart with each contraction. This is one reason chair-based strength movements often improve endurance more effectively than slow walking in older adults. Every time you stand up from a seated position, your heart rate rises slightly when repeated in a controlled manner. This creates a gentle cardiovascular challenge without the prolonged stress of long-distance walking. Surgeons often describe this as interval-like movement, where the heart works a bit harder, then recovers, then works again. This pattern is especially beneficial for aging hearts. Walking, particularly at a slow pace, may not elevate heart rate enough to create meaningful cardiovascular adaptation in seniors. Many older adults walk at a speed that feels safe but doesn't challenge the heart. Chair-based exercises, on the other hand, naturally create short bursts of effort that stimulate circulation and oxygen delivery more effectively. There's also the issue of fatigue. Long walks can drain energy, especially in people managing blood pressure issues, diabetes, or joint pain. Fatigue often leads to reduced activity for the rest of the day. Sit-to-stand exercises are brief and localized, leaving energy available for other daily movements. Surgeons favor this because total daily activity often matters more than a single long exercise session. Another important factor is insulin sensitivity. Large muscle groups like the thighs and hips play a major role in blood sugar regulation. When these muscles contract, they absorb glucose from the bloodstream without requiring as much insulin. This is especially valuable for adults over 65, many of whom are pre-diabetic or managing type 2 diabetes. Chair squats directly activate these muscles in a way walking often does not. Surgeons working with metabolic patients often prescribe sit-to-stand routines for this exact reason. They've seen improvements in blood sugar control, energy levels, and even mental clarity. When muscles are engaged regularly, the entire body functions more efficiently. Balance improvements also have a cardiovascular connection. When balance is poor, the body stays tense, muscles tighten, breathing becomes shallow, and the heart works harder under stress. Training balance through controlled standing and sitting teaches the body to relax while moving. This reduces unnecessary cardiovascular strain. There's a neurological component too. Standing up from a chair requires coordination between the brain, spinal cord, and muscles. This coordination strengthens neural pathways that control movement and reaction time. Walking on flat surfaces doesn't challenge these pathways as much. Surgeons value this because faster reaction time can prevent falls and injuries that lead to heart deconditioning through prolonged bed rest. One of the biggest misconceptions is that walking is always safer. For many seniors, uneven sidewalks, curbs, and weather conditions increase fall risk. A fall can undo years of cardiovascular progress in a single moment. Chair-based exercises provide a controlled environment where movement can be practiced safely, reducing overall health risk. This doesn't mean walking has no place. Surgeons don't recommend eliminating walking entirely. Instead, they see sit-to-stand exercises as the foundation. Once strength and balance improve, walking becomes safer, more efficient, and more enjoyable. In fact, many patients report that walking feels easier after just a few weeks of consistent chair exercises. Consistency is the real secret. 5 minutes of effective movement done daily often outperforms 30 minutes done inconsistently. Sit-to-stand exercises fit naturally into daily life. You can do them before meals, during television breaks, or whenever you notice stiffness setting in. This frequent activation keeps the cardiovascular system engaged throughout the day. There's also a psychological benefit worth mentioning. Completing a simple, effective exercise builds confidence. Confidence leads to more movement. More movement leads to better heart health. Surgeons often say the best exercise is the one you'll actually do, and this is one of the most sustainable options available for adults over 65. When surgeons talk about healthy aging, they rarely focus on appearance or even fitness in the traditional sense. Their primary concern is independence, the ability to live without constant assistance, to get up from a chair, use the bathroom safely, climb a few steps, and recover quickly if balance is lost. This is where this single exercise truly stands out. Falls are the leading cause of serious injury among adults over 65. Most falls don't happen while walking long distances. They happen during everyday transitions. Standing up too quickly, sitting down without control, turning suddenly. The sit-to-stand movement directly trains the body for these exact moments. Each repetition teaches your muscles how to coordinate under load. Your ankles stabilize, your knees align, your hips activate, your core tightens just enough to keep you upright. Over time, this improves something called anticipatory balance, meaning your body learns to prepare for movement before it happens. This is a key skill that often declines with age. Walking does not train this skill nearly as effectively. Walking is repetitive and predictable. Sit-to-stand movements require constant adjustment. The brain must calculate force, balance, and timing every single time. Surgeons value this because it keeps the neuromuscular system sharp. Joint protection is another major advantage. Many seniors avoid exercise because of knee or hip pain, but avoiding movement actually accelerates joint degeneration. Controlled chair-based movements nourish the joints by circulating synovial fluid, which acts as lubrication. This reduces stiffness and discomfort over time. Surgeons often explain that joints are like hinges. They need movement to stay healthy, but they need the right kind of movement. High impact or repetitive stress can wear them down. Controlled strength movements, done within a comfortable range, strengthen the muscles around the joint so the joint itself doesn't take the full load. This is especially important for the knees. Weak thigh muscles force the knee joint to absorb more stress during daily activities. Strengthening the quadriceps through sit-to-stand exercises reduces this load. Many patients report less knee pain after a few weeks, even though they are technically exercising more. Hip health improves as well. The hips are central to balance and gait. When hip muscles weaken, stride shortens and stability decreases. Sit-to-stand movements engage the hips through a functional range, improving both strength and mobility. Surgeons often see improved walking patterns in patients who consistently perform this exercise. There's also a spine benefit. Standing up correctly requires neutral spinal alignment. Over time, this reinforces better posture. Better posture reduces compression on the spine, eases back pain, and improves breathing. Improved breathing supports oxygen delivery, which benefits every system in the body. Another overlooked aspect is bone health. While walking does provide some bone stimulus, it's often not enough after 65, especially if pace and intensity are low. Sit-to-stand movements apply gentle, vertical loading through the bones of the legs and hips. This signals the body to maintain bone density, reducing fracture risk. Surgeons frequently recommend this exercise to patients with early osteoporosis or osteopenia because it provides bone stimulation without the high fall risk of outdoor activity. Safety is always a priority. Independence also depends on endurance for daily tasks. Think about how often you stand up throughout the day. From the couch, from the toilet, from the car. Each of these moments requires strength. When that strength fades, people begin to rely on armrests, caregivers, or avoid movement altogether. Sit-to-stand training directly restores this ability. There is also an emotional component. Losing the ability to stand independently can feel devastating. Regaining it can be empowering. Surgeons see this psychological boost as a critical part of recovery and long-term health. People who feel capable move more, socialize more, and experience better overall well-being. Perhaps the most important reason surgeons approve this exercise is its low risk-to-benefit ratio. It delivers strength, balance, circulation, and confidence with minimal equipment and minimal danger when performed correctly. That's rare. What makes this exercise so powerful isn't just what it does in isolation, but how easily it fits into real life. Surgeons know that the best routine is one you can maintain without stress, confusion, or fear of injury. That's why they often recommend building your day around small, consistent movement rather than one long workout. A simple way to integrate sit-to-stand exercises is to anchor them to habits you already have. For example, before breakfast, stand up from your chair 5 to 10 times. Midday, do another small set before lunch or while watching television. In the evening, repeat the movement once more. These short sessions add up, keeping muscles active and circulation flowing throughout the day. This approach reduces stiffness that comes from prolonged sitting, which is one of the biggest health risks for older adults. Long periods of sitting slow circulation, tighten joints, and weaken muscles. Frequent sit-to-stand movement acts like a reset button for the body. Surgeons often suggest pairing this exercise with light walking rather than replacing walking entirely. Once leg strength improves, walking becomes safer and more efficient. Even short walks around the house or yard feel easier when the muscles are stronger. This combination provides cardiovascular benefit without overloading the joints. The key difference is order. Instead of walking first and tiring the legs, do a few sit-to-stand repetitions first. This activates the muscles and stabilizes the joints, reducing pain and improving movement quality during the walk. Many patients are surprised by how much smoother their steps feel after just a few weeks. Progression should be slow and intentional. After the movement feels easier, you can increase difficulty in simple ways. Slow the lowering phase to 3 or 4 seconds. Pause briefly at the bottom before standing. Cross your arms over your chest instead of using your hands. These small changes dramatically increase muscle engagement without adding risk. Surgeons caution against rushing progression. More is not always better. The goal is consistency over months and years, not pushing to exhaustion. Mild muscle fatigue is fine. Joint pain is not. If discomfort arises, reducing depth or repetitions is usually enough to stay safe. Listening to your body is part of healthy aging. Some days you'll feel stronger than others. That's normal. On lower energy days, even a few repetitions help maintain muscle memory. Skipping movement entirely is what leads to decline. Another reason this exercise works so well is that it restores trust in the body. Many seniors move cautiously because they're afraid of falling or hurting themselves. Controlled sit-to-stand movement builds confidence. Confidence leads to better posture, smoother motion, and more willingness to stay active. Surgeons often say aging well isn't about avoiding movement, it's about choosing the right movements. This exercise supports nearly every system involved in longevity. Muscles stay strong, joints stay nourished, bones receive healthy stress, the heart works efficiently, the brain stays engaged. Over time, these benefits compound. Better strength leads to better balance. Better balance leads to fewer falls. Fewer falls mean fewer hospitalizations. Fewer hospitalizations protect cardiovascular health and independence. It's a chain reaction that starts with something as simple as standing up from a chair with intention. For adults over 65, this movement represents a shift in mindset. Exercise is no longer about distance, speed, or sweating. It's about control, stability, and function. Surgeons approve it because it aligns with how the body actually ages. Walking still has value. Fresh air, mental clarity, and gentle cardiovascular support all matter. But walking alone isn't enough anymore. Without strength, walking becomes less effective and more risky. This is why many surgeons now say this single exercise may be better than walking as a foundation for health after. If you commit to this movement daily, even in small doses, you're investing in your ability to live independently, move confidently, and age on your own terms. If there's one message surgeons want adults over 65 to truly understand, it's this. Aging doesn't take strength away overnight. It happens quietly, through small daily habits that either support the body or slowly weaken it. And the good news is that the same is true in reverse. Small, intentional movements done consistently can restore strength, balance, and confidence far more effectively than long, exhausting workouts. The simple act of standing up from a chair, done with control and purpose, targets the exact abilities that determine how well you age. Not how far you can walk on a good day, but how easily you can get up, stay steady, and move through daily life without fear. That's why surgeons approve this exercise. It protects joints instead of punishing them. It strengthens muscles that matter most. It trains balance where falls actually happen. And it supports heart health in a way that fits the aging body. Walking will always have its place. It clears the mind, supports circulation, and keeps you connected to the world outside. But after 65, walking alone is no longer enough. Without strength underneath it, walking becomes less effective and sometimes unsafe. Strength is what makes walking useful. Strength is what makes movement confident. This is why so many surgeons quietly shift their advice as patients get older. They stop focusing on steps and start focusing on transitions. Can you stand up without using your hands? Can you sit down with control? Can you steady yourself if you lose balance for a second? These abilities matter more than miles walked. What makes this exercise truly powerful is that it puts control back in your hands. You don't need a gym. You don't need perfect weather. You don't need special equipment. You only need a chair, a few minutes, and the willingness to move with intention. That simplicity removes excuses and builds consistency, which is where real change happens. Over time, these small efforts add up. Muscles regain tone, joints feel less stiff, balance improves quietly but noticeably. Movements that once felt risky begin to feel natural again. Confidence grows, and with it, independence. That independence is what most people truly want as they age, even more than longevity itself. Surgeons see the difference between patients who move this way and those who don't. One group recovers faster from setbacks. They avoid falls. They maintain mobility. The other group slowly gives up movement, often without realizing it, until weakness becomes a major obstacle. The difference isn't age, it's daily action. This exercise isn't about pushing through pain or chasing fitness goals from decades ago. It's about respecting how the body changes and choosing movements that work with those changes, not against them. It's about building a foundation that supports everything else you want to do. If you're over 65 and you want to stay active, safe, and independent, make this movement part of your day. Do it slowly. Do it consistently. Let it support your walking, not replace it entirely. And remember, the strongest bodies in later life aren't the ones that do the most. They're the ones that do the right things, every day. That's why this one simple exercise may truly be better than walking alone, and why surgeons continue to recommend it for aging well.